Stop now if you want to keep your inner vision. Stop the scrolling, the asking everyone else for permission to feel, the habit of outsourcing what you already carry in your body. If you keep looking outward for every answer, that inner sight will dull like a once bright lens left in shadow. I am asking you to stop, not as punishment, but as an invitation. Cease the behaviors that steal your recollection, so you can begin to remember. A brief note for clarity before we begin. What follows draws on non-canonical manuscripts discovered in the mid-20th century, the Nag Hammadi codices and texts like the Gospel of Philip, and on a living interpretation of those Gnostic traditions. These sources preserve a different set of metaphors and practices than the canonical Gospels. I offer them here as a perspective and a practice, not as a definitive statement of mainstream Christian orthodoxy. Also, this is not medical advice. If any movement causes pain or distress, stop and seek professional guidance. Why stop? Because most of us have learned to accept perception filtered through others. We've been schooled to trust institutions, authorities, screens, and applause as proof. Those external measures are useful at times, but when they become the primary referee of your knowing, they create a chronic dependence that dims the very faculty they claim to certify, your inner vision. The Gnostic manuscripts unearthed near Nag Hammadi in 1945 speak, in their own symbolic language, of remembering a source and reclaiming direct sight. Whether you read those writings as literal history or poetic code, they insist on one thing. There is a form of knowledge that is bodily and immediate, anamnesis, the act of remembering from within, and it will not survive if you constantly hand responsibility for perception to others. To understand what to stop, it helps to know what you are up against, at least in the language of these texts. The manuscripts describe a model of interference, a lesser creative force sometimes called the demiurge, and attendant influences, often named archons. Read carefully. These are not necessarily physical beings that you can point to on a map. Think of them instead as patterns, psychological, social, technological, whose effect is to manufacture doubt, to keep attention outward, to create noise. In modern terms, archons would look like the habits of comparison, the constant need for external approval, the barrage of distraction designed to keep you unmoored. The demiurge, in that symbolic mapping, is the system that privileges appearance over essence. Against that backdrop, the Gnostic tradition speaks of the pneumatic, those who are breath-connected to the source, who carry a latent memory of origin in their body. That memory, according to these accounts, can be recovered. Anamnesis is the reawakening. Not a new piece of information, but a recall, a felt recognition that rearranges how you move and decide. It is not guaranteed, and it does not replace discernment or stability. It is simply a reclaiming of perceptual authority. And it tends to arrive through the body, not through doctrine alone. Because of that, the practice I will guide you through is somatic, bodily, slow, grounded. The texts and the tradition name 3 loci, or somatic signposts, described as subtle marks or textures, one at the base of the skull, a kind of origin point, one along the outer edge of the hand between pinky and wrist, a site of perception, and one in the center of the chest above the sternum, a place of declaration or command. I am careful to call them signs as described in those traditions. They are not clinical diagnoses, they are not printed maps on anatomy charts. They are experiential cues you can gently explore in quiet. Before you touch anything, stop a second. Slow your breath. Stop giving your attention to the next notification, to the next opinion. Keep your hands soft. This is not an invasive check. If you are pregnant, have a recent injury, or any condition that makes touch uncomfortable, simply use gentle awareness instead of touch. Keep your focus on sensation, not on expectation. And trust that the first time you try, you may feel nothing, or you may feel something subtle. Both responses are normal. We'll begin with the base of the skull. Place both hands behind your head, palms cupped against the neck, thumbs resting at the nape. Let your shoulders drop. Breathe in slowly and feel the weight of your head against your hands. With the pads of your fingers, without pressing hard, let your attention land at the very base where the skull meets the neck, the occiput region. You are not looking for pain. You are inviting awareness to notice texture, temperature, a tiny hollow, or the sense of something there. Some people describe a faint coolness, a soft ridge of tissue, or an almost musical tingling under the fingers. Others feel a quiet stillness, like a room settling. If you feel nothing, do not judge. If you feel something, do not narrate it into conclusion, simply note it. Name it in one word: quiet, cool, ridge, nothing, and let that be enough. Now stop again. If, in your life, you habitually look outward for authority, make a small resolution right here. Stop asking the next voice to tell you what you already feel. Let your hands be an instrument of memory. The second place is the lateral edge of the hand. Extend your hand, palm facing you, and then tilt it slightly so the thumb side is up and the outer edge of the little finger side, between the base of the pinky and the wrist, faces you. Use the pads of your opposite hand's fingers to trace slowly along that edge from the knuckle down toward the wrist. You are feeling for a line, a subtle crest, a place where the skin or fascia offers the slightest resistance, or perhaps a warm or electric sensation. Move slowly, like a painter making a single deliberate stroke. Notice any change in attention as you trace that path. Perhaps perception sharpens in the fingertips. Perhaps your sense of space around the hand widens. That increase in sensitivity, however small, is a sign that your nervous system is retuning its priorities from outside input back to bodily information. If the thought, "this is nonsense," rises now, do this instead of arguing with it. Breathe, observe the thought as an object, and return your attention to the touch. That counterthought is often the first response of the archonic pattern, immediate dismissal that keeps you from learning. Name the dismissal, there's doubt, and then return. Do not expend energy trying to defeat it. The practice is to notice and to keep coming back. Third, the center of the chest. Place the flat of your hand gently over the center of your sternum, a couple of inches above the heart. This is not a pressure test. The touch is soft, almost like resting your hand on a warm surface. Breathe into the place beneath your hand. Some people feel expansion, like a small balloon filling. Others sense a point of stillness that answers when it is addressed. Imagine this point as a seat of authority in your body. When you touch it, speak softly to it, aloud or inside. One short phrase you will remember. If speech is not possible where you are, think the phrase clearly. What matters is the direction of your attention, from thought into felt experience. Take your time between each step. If any touch causes pain or vertigo, stop. If you have medical implants, recent surgeries, or other conditions, use awareness without touch. This is about returning attention, not about creating discomfort. When you have completed the 3 checks, base of skull, lateral hand, center chest, mark how you felt. A subtle warmth? A brief shiver? A thought that cleared for a beat? All of these are valid. Do not fall into the trap of needing an extraordinary sign. Inner vision, as the tradition describes, often arrives as a small recalibration, a little more confidence in a quiet moment, a lowering of the volume of self-critique, a steadying of decision-making. It accumulates. If you felt anything at all during that check, no matter how small, type recognition in the comments. If nothing at all stirred, that too is information. Either way, pause and give yourself the grace to be where you are. Do not measure your progress against someone else's report. This is how you keep the practice honest and avoid trading inner sight for external applause. Expect resistance. Immediately after this exercise, your mind may flood with a sequence of doubts. Did I imagine that? Am I being gullible? Is this safe? That reflex is part of the system that keeps people looking outward. Name it. That's doubt. Do not answer the doubt with argument. Respond with observation. Notice the tone of the thought, perhaps its speed or its tried-and-true phrasing, and then return to the body. A concrete technique: when doubt arises, place one hand lightly over the center of the chest and breathe 3 slow, full breaths. Each time you breathe out, allow the mind's volume to lower, as if turning down a radio. Then, after those breaths, return to your chosen locus, the base of skull or the hand, and attend again. Over time, those repetitions teach your nervous system to accept bodily cues as legitimate sources of knowing. You may wonder what actually shifts when anamnesis takes hold. Think of perception as an attending field that can be trained. Right now, for many people, the field is set to register external signals, likes, expert voices, trending narratives. When the field is recentered through somatic practice, attention begins to privilege inner signals: a felt yes or no, a tightening in the chest that flags falsehood, a widening in the throat that presages clarity. People who report this shift do not claim that their life becomes free of ambiguity. Rather, they describe a recalibration: fewer compulsions to ask permission, more capacity to act from embodied conviction. That is the practical fruit of preserving inner vision. Be prepared for social consequences. Inner seeing rarely aligns neatly with the incentives of every community. When you rely less on external validation, you may encounter loneliness, skepticism from friends, or the temptation to mimic old habits. That is why the practice is both private and social. Private as daily reclaiming. Social as finding companions who respect inner authority without becoming new intermediaries. Seek community that encourages direct experience and accountability without prescribing every feeling. In this way, you stop the habit of outsourcing again, but you do not stop caring for wise companionship. The aim is autonomy in perceiving, not isolation. Now, the activation practice I recommend is short and repeatable, designed to be done nightly, before sleep, in a quiet space. Commit to a gentle routine lasting about 90 seconds total, roughly 30 seconds at each locus. Find a consistent place and a consistent posture. The power of the practice is not in ceremony, but in repetition. Begin seated or lying in a comfortable position. Close the eyes. Breathe 3 steady breaths to settle. Place the fingers at the base of your skull and, for 30 seconds, rest your attention there. Notice texture, warmth, any micro-sensations. Say, softly and deliberately, the 9-word declaration: I remember my source, awaken perception, claim my command. Let the phrase be an address, short, sovereign. Do not expect fireworks. Let it land, like seed on soil. Move your hand to the lateral edge of the opposite hand. For 30 seconds, trace the line between pinky base and wrist. Listen to the breath, notice the skin's response. Speak the phrase once more, with intention. Feel the phrase integrate into sensation. No need to interpret, simply notice. Finally, rest your hand over the center of your chest for 30 seconds. Breathe into that point and speak the phrase a third time. Imagine the words sinking slightly into the body, like a light settling into a room. Allow the practice to close with gratitude for showing up. If you prefer not to use touch, you can perform the same sequence by visual attention alone. Direct your inner gaze to each place for 30 seconds and speak the phrase. If you experience doubt while doing it, again, place gentle attention on the doubt as an object and return to the breath and the locus. If any moment creates discomfort, reduce pressure, shorten the time, or simply rest your palm on your lap and breathe. Do not treat the declaration as a magic formula that forces a result. It is a civic statement of sovereignty, an affirmation that you will no longer outsource the authority of your perception. Many people have reported an increase in interior clarity with regular practice. Others notice subtle shifts that ripple slowly. That is the nature of deep change. There is no guarantee. There is invitation and disciplined tending. There are practical habits to stop right now if you want to keep the inner vision you are cultivating. Stop letting every split-second impulse seek external confirmation. Stop using endless comparison, social feeds, comment threads, metricized approval, as a substitute for your own felt sense. Stop surrendering your spiritual choices to a chain of intermediaries whose primary role is to mediate rather than to empower. Stop filling quiet moments with noise. Stop equating busyness with insight. Each of these habits eats away at the capacity to recognize the subtle signals we just explored, and start replacing those habits with small, daily acts of return. 10 minutes of quiet reading, 5 minutes of centering breath before decision-making, the 90-second nightly routine, and 1 weekly conversation with someone who takes experiential witness seriously. These practices do not require institutions to validate them. They require your steadiness. If you are worried about theological fit, if you stand in a tradition that values canonical scripture, hear this. Reclaiming inner perception is not necessarily in conflict with devotional life. Many faithful people have learned to sit with both scripture and direct experience. The Gnostic texts simply offer another vocabulary for what some communities have called the witness of the Spirit. Use what nourishes you and leave what creates division. There will be a temptation to rush, to demand instant proof. Resist it. Inner sight is not a spectacle. It is a practice of fidelity to the body's wisdom. Keep your expectations small and your repetition consistent. If you are tempted to tell everyone about a single subtle sensation, consider first sitting with it for a week. Does it change your conduct? Does it help you act with more integrity? That practical test is often the truest measure. You may also wonder about the ethics of claiming inner knowledge. Here is a simple rule. Use your inner vision to foster compassion and clarity, not to dominate or coerce. Sovereignty of perception does not license superiority. If your inner experience calls you to speak, do so with humility and invitation. Finally, a gentle caution about what to avoid. Do not substitute these practices for professional medical or psychological care. If you are experiencing significant distress or physical symptoms, seek appropriate help. Somatic practices are supportive, not a replacement for trained intervention when needed. Stop now if you want to keep your inner vision. Let that stop be precise. Stop seeking every answer outside your own body. Stop allowing distraction to erode your attention. Stop outsourcing your authority. Begin instead a disciplined tending, twice daily breaths, the 90-second nightly activation, and a slow apprenticeship to the felt life. Over weeks, these small decisions rewire how you know. If you felt anything during the somatic check, type recognition in the comments. That single gesture builds a quiet community of witnesses without turning anyone into an intermediary. This path carries a certain solitude at first, because you are learning to trust a source others may not see. Yet you need not walk it alone forever. Seek conversation with those who encourage practice over proclamation. Look for companions who ask, "What did you notice?" rather than, "What did you read?" Those companions will help you stay grounded without stealing your sight. In closing, return again to the title and take it as a practical command rather than an abstract slogan. Stop now if you want to keep your inner vision. Stop the small habits of external validation that dim clarity. Stop the relentless checking that trains your attention outward. Begin the gentle, consistent practices that resettle perception in the body. Use the 3 loci as anchors: base of the skull, lateral hand, center of chest, practiced with care and humility, accompanied by the simple 9-word declaration, "I remember my source, awaken perception, claim my command." This is an invitation, not a coercion. Take it as a daily fidelity. If you choose to practice, do so kindly and consistently. If you decide it is not for you, carry forward the core counsel anyway. Sometimes the most radical thing you can do for your clarity is to stop what has been stealing it. Subscribe to continue the activation series and learn grounded practices to sustain inner vision.